My name is Darren Roblyer. I have a lab at the CRC in biomedical engineering called the Bot Lab, and we develop translational optical technologies for a number of different disease states. We've been working in cancer for a long time. Going to tell you about that project today. So the clinical problem we're trying to solve is visualized here. So these are MRI images, not optical images. But you can see a tumor against the chest wall in this breast cancer patient. She's given several months of chemotherapy. The treatment works well. She's reduced her risk of death by about 68%. Compare that with patient two, very large tumor on most of the breast, same chemotherapy, chemo didn't work. About 20% of patients treated in this way have this outcome. Another 60% are partial responders, meaning that these patients are going through months of treatment without real benefits. You could even say maybe we're wasting time for these patients. And this is true even in the era of molecular medicine, personalized medicine, immunotherapies, and others. There's a technological barrier. If you think about anatomic imaging modalities like ultrasound, CT, MRI, the actual size of the tumor tends to be a lagging indicator. So by the time we know that tumor is shrinking, it's actually kind of late to do anything. Metabolic information from FDG PET has been shown to be more useful, but it's so expensive and difficult to use that it's really not likely to be part of the standard of care for longitudinal monitoring. So that's where optics comes in. Optics, the way we do it, requires no exogenous contrast agent. We measure what's native in the tissue. We have multiple versions of the technology, and it's evolved over time. So for example, we have this handheld version of the technology. We scan it across the tissue, kind of like an ultrasound. And then we can get quantitative levels of oxy and deoxyhemoglobin in the tissue, as well as water and lipid, which gives us some sense of molecular contrast. And then we can make maps. This is just a 3D rendering with real patient data on top of it. You can see the tumor here. So here's where hemoglobin levels are higher from angiogenesis, water levels are higher from edema, and lipid levels are lower. That tumor is pushing out the natural fats in the breast. And we've shown over a number of studies over the years that we can identify responders versus non-responders quite early. For example, in a specific cohort shown here, we saw that responders had this increase in oxyhemoglobin that occurred very early, 24 hours after the first administration of the first chemotherapy dose. The non-responders didn't have it. So the story gets more complicated as we look to broad patient populations in breast cancer, but that's one example of an early biomarker of response. Now, over time, we've developed the technology to become more compliant with the patient. Here's an example of a wearable probe that's currently just concluded a clinical study here at BMC. It conforms to the shape of the breast, and we can dynamically measure hemodynamics within the tissue and associate that with response. And then looking forward to the future, our next step is in the technology is to try to overcome one of the barriers we have in conducting clinical studies. And it's really quite a burden on the patient to be measured longitudinally. We want to do it every week if we can, but these patients are undergoing chemo. It's already a lot. They don't feel good, and having them stay longer for imaging is tough. So we want to develop a technology that the patient can take home with them so they can image their own tumor and send us the data. So we're getting used to this for other technologies, for blood pressure, for glucose, like shown here, but nobody's done this for imaging, and especially not for breast cancer. So we have a new grant from the American Cancer Society. We've just started. This is a conceptual image. There's many technical and practical hurdles we'll have to get over. I'll just end by saying we've been working with Naomi Ko for over about 10 years now. We are looking for other collaborators in breast cancer and beyond. So I'd be happy to talk to you if you want to talk about this project. But thanks for your time.